Hello, and welcome to How to Take Your Blood Pressure Properly at Home. My name is Paula Rains. I am a licensed practical nurse working for Central Connecticut Cardiology in their Enfield office. A little bit of background about me. I attended Slippery Rock University with a degree in Bachelor of Science degree in exercise science as well as psychology. I then moved to Connecticut and worked for Aetna in their fitness department for 4 years before I was laid off. And upon that opportunity, I went back to school and became a licensed practical nurse. Went to school in New Britain. It was a school called New England Technical Institute. I got my degree in practical nursing, took my boards, and went on to become a nurse for Cromwell Family Practice. I worked there for a little while before I realized that that wasn't the right fit for me, and I moved on to a long-term care facility and rehab center in Glastonbury, Connecticut, where I remained for the next 8 years of my life. After that, I moved on to Central Connecticut Cardiology once I had children and needed to change the job to fit my home life. I've been there for 6 years, and in that 6 years, I've worked my way up to the head nurse at the Enfield office. So that's a little introduction of who I am, and what I would like to talk to you today about is blood pressure. We're going to talk about why blood pressure is important, what blood pressure is, what blood pressure can affect, why we want to monitor it at home, and how to monitor it properly, as well as what equipment you will need in order to monitor your blood pressure appropriately at home. So, first thing we want to talk about is what blood pressure is. So blood pressure is the force of blood against the walls of the arteries. So that means when your heart is contracting, how much force is the part pushing out? And so with that, we have two numbers. We have the top number of the blood pressure, which we call the systolic number. And then we have the bottom number, which is what we call the diastolic number. So the systolic number is the number at the top where the heart contracts. That's when the left ventricle of the heart pushes out the blood into the body, and we want to see how the force of that blood is against the artery walls. And that number is our systolic number. The bottom number, again, the diastolic number, is the number that we get when our heart relaxes and it fills back up with blood. So those are the two numbers that comprise what blood pressure is. We want to talk about why these numbers are important and what is the most important number. Is it the top number or is it the bottom number? Plain to say, both numbers are very important. But when you're looking at it from a cardiovascular standpoint, we like to look at the top number, the systolic, the contraction of the heart, because the higher that number is, that means you're at increased risk for cardiovascular disease. So that's why we're looking at that number, to make sure that that number doesn't go over a certain range. And we will talk about what those ranges are for normal blood pressure, elevated blood pressure, hypertension 1, hypertension 2. So those are all the stages. We will talk about that pretty soon in the presentation. So why is it important to keep your blood pressure under control? High blood pressure can have an effect on your entire body, from your eyes, your kidneys, diabetes, your heart, your vision, your memory. It has an effect on everything in the body. So these are the reasons why we want to talk about controlling your blood pressure at home. Blood pressure can cause you to have kidney issues. So when your blood pressure goes up, your kidneys can't filter out the water as effectively. And so it can lead you to have kidney failure. It can also cause you to have visual issues with your eyes. It can have you go into like memory loss and dementia. All these things are affected by high blood pressure. We do know that high blood pressure puts you at an increased risk for heart attack and for stroke. Those are the two main things that people look at when they are concerned about having high blood pressure. The number one thing is We hear that it can cause a stroke, and this is true. The reason that high blood pressure can cause a stroke is because when your blood pressure is high, it causes your arteries to harden, which means that the heart has to work harder to force that blood out, and there's more pressure. And that will put you at an increased risk to have a stroke. Another thing that it can affect is what we call an aneurysm. An aneurysm is when we have like a thinning or a bulging of your artery. This is very important because if you have an aneurysm and the aneurysm bursts, it could be a life-threatening situation. So that would be a very important reason why we want to make sure that we are keeping our blood pressure under control. Another thing that blood pressure will affect is your heart. It can cause you to have heart failure. So heart failure is different than a heart attack. Heart failure is the pumping power of the heart. So when you have high blood pressure, it causes a thickening of the bottom chamber of your heart called the left ventricle, which is really the powerhouse of the heart, because that pushes the blood through the valve up into the atrium and out into the body through the aorta. And so that really services the entire body. So when you have hypertension, it has to work harder to do this, and as an effect of working harder, it becomes thickened, and what we call hypertrophy. And so once that happens, we have less mobility in the heart. So when the heart is pumping, it normally would pump like this, and when you have the thickened artery, it's pumping a little more like this and not as much range because of the thickening, so the heart has to work harder, and therefore it would eventually go into heart failure. So another important reason why we want to make sure that we monitor the blood pressure on a regular basis at home if you have hypertension. Other things that it causes, as I said, the weakened and narrowed blood vessels of the kidneys, which could lead you to having kidney disease or renal disease. The same thing happens with the eyes, which would cause you to have see spots, lose your vision, all sorts of different things with your eyes. It also can have issues with memory loss and dementia. All of these things are affected by blood pressure. So we have why we want to make sure that we are controlling our blood pressure. As you can see, the blood pressure will affect almost every part of your body if we leave it to be uncontrolled. So we want to make sure that we monitor our blood pressure so that we know that we are keeping it under control. Things that you need to be aware of when we're monitoring our blood pressure, or about high blood pressure, I should say. Oftentimes, high blood pressure is called the silent killer. And the reason they call it that is because with high blood pressure, you don't necessarily have to have symptoms. A lot of people could be walking around with high blood pressure and not know it because they are not having any symptoms of high blood pressure. So again, you're walking around with high blood pressure, you don't know it because you're not having any symptoms, but it puts you at an increased risk for heart attack, an increased risk for stroke, an increased risk for heart failure, kidney disease, and all these other things. So good reason why we want to make sure that we are monitoring our blood pressure. There are certain stages of blood pressure. As I mentioned before, we have normal blood pressure, we have elevated blood pressure, we have stage 1 hypertension, and stage 2 hypertension. So these numbers are, if your blood pressure is less than 120/80, that's always been the magic number, 120/80, then you are considered to have normal blood pressure. If it's less than 120/80. When you get to 120 to 129 over less than 80, that is what we want to call elevated. So when you have elevated blood pressure, we just want to keep an eye on it, maybe, sporadically throughout the year. You don't have to keep a regular eye on it, but we just want to make sure that it doesn't then move up into hypertension 1, which is 130 to 139 over 80 to 89. So hypertension 1, again, we will look at your blood pressure. We will monitor you a little more closely than we would with the elevated. You may or may not be put on medication for this. And then hypertension 2, of course, is 140 over 90 consistently. So when you get to stage 2 hypertension, that's when you're going to start to see the doctors want to put you on medication. You're going to be having to come in to see the doctor more frequently than you normally would, because we want to make sure that this blood pressure, of course, is controlled. So monitoring your blood pressure at home, you can keep a record at home of your blood pressures, and that will help to minimize the cost of having to go into the doctors, because you can monitor at home. You can simply call your doctor and say, hey, my blood pressure for the last 2 weeks has been running blah, blah, blah. And the doctor may be able to adjust the medication right there over the phone, saving you money from your copay. We won't have to pay the insurance. So one of the many reasons why you might want to monitor your blood pressures at home, because it can eventually save you and your insurance money. How do we treat blood pressure? We treat blood pressure with different medications. There are diuretics. Diuretics are water pills. So what happens is with the diuretics, it rids your body of extra fluids in your body. So when you rid your body of extra fluids, that decreases the blood pressure, because remember, blood pressure is volume. So when you have more water volume in your body, then your blood pressure is going to be higher. So we would put you on diuretics to help decrease the volume in the body of fluid, to help lower the blood pressure. There are also other medications that they use that will help to decrease the blood pressure. Excuse me 1 second if I get to those. So those are beta blockers. Beta blockers are like metoprolol and atenolol. Some of you might know the names of those medications. Those medications help to lower the heart rates, okay, which helps increase the blood flow through the body. And those are reasons why we use those medications. Then we have medications called vasodilators, ACE inhibitors, calcium channel blockers, things that you don't need to know right now, but those are also medications that we use that help to relax the blood vessels, because when we have high blood pressure, that means our vessels are constricting and they're tight. So these medications will help to loosen up and relax those blood vessels so that the flow of blood will be more smoothly through the body. So those are the 3 main medications that they use. There are other things, of course, that you can do on your own to help treat high blood pressure. So what are some of the things that we can do to help treat blood pressure? So we can work on our diets, okay? High sodium diets, high fat diets will put you at a higher risk for high blood pressure. Sodium and water work together. So wherever there's sodium, there's water, because water follows salts. So if you have a high salt intake in your diet, you like potato chips, those things are going to help you to have high blood pressure. And again, the reason why that is because if you have a lot of sodium in your body, you're going to have a lot of water in your body. And as I just said previously, blood pressure is blood volume. And if you have more water in your body, then you're going to have higher blood pressure. So we want to make sure that we're working on a diet that is low in salts, okay? If you use a lot of canned foods, canned products, that sort of thing, in this day and age in the supermarket, we have a ton of different things. So there are low sodium tomato sauces, low sodium canned beans, low sodium chicken broth. I would find all the things that have no added salts or low sodium if you have hypertension. Some other things that we can do, of course, is exercise. Exercising is a great way to get your blood pressure down. Part of the reason why exercise is so important is because when you're exercising, you are training your heart to pump more efficiently. So a person who is an athlete, who their resting heart rate could be 50 beats per minute. And for the average person, that seems really low. But for an athlete, that is what a normal blood pressure is, because their heart is trained and conditioned so well that it doesn't have to beat as often or as frequently to pump blood throughout the body. So increasing your exercise component in your life will help with your heart efficiency, which will help decrease your blood pressure. We also want to talk about weight loss. Of course, obesity is one of the main factors of high blood pressure. So if we can decrease our weight volume, then we can also decrease our blood pressure. Alcohol has a big effect on blood pressure as well. So decreasing your alcohol consumption will help to lower your blood pressure. So for an average adult, alcohol consumption should be no more than 1 drink for a female in a day and 2 drinks for a male in a day. So what is a drink size? A drink size consists of, I believe it is 5 ounces of wine, 3.5 ounces of 80% proof liquor, and 10 ounces, I believe, of beer. So if you are a female, you should not be having 1 of any of those drinks a day. And for a man, it should be no more than 2 of those. Now, if we decrease the amount of alcohol in our systems, in our daily use, that will have an effect not only on our health as far as our blood pressure, but it also help with our weight loss, because alcohol, of course, is empty calories, which puts on weight. So decreasing your alcohol will also aid in your weight loss, which also aids in your lowering your blood pressure. So those are things that we can do. Smoking is another huge thing that affects your blood pressure. So if we want to decrease our blood pressure, we can decrease the amount of smoking that we do, or of course, stop smoking altogether. Smoking, of course, has many bad habits, one of them being the constriction of your vessels in your arteries. And so by not smoking, we of course widen up those arteries, and you are then able to decrease your blood pressure. Stress is something that affects your blood pressure. People who are type A personalities, high strung, everything has to be perfect, they usually have high levels of stress in their life. By decreasing their stress, taking a time out, relaxation, deep breathing, those sorts of things can help decrease your hypertension. Stress has an effect on your blood pressure right in that moment when you're feeling that stress, but it also has a long-term effect on what happens with your blood pressure. And then, of course, the last thing to control high blood pressure is the blood pressure medications, as I discussed previously, the different types of blood pressure medications. So that's controlling your blood pressure. What are the risk factors of your blood pressure? The risk factors are exactly what I was talking about as far as controlling your blood pressure. Those are the things that you can do on your own for controlling your blood pressure. There are some risk factors that you just have absolutely no control over. One of those things is age. So your age, as you get older, your blood pressure tends to go up. That is just something that happens. It's usually more prominent in men up until about age 64, your high blood pressure. But then after age 64, it becomes more prominent in women. Then there is your race. High blood pressure is particularly common among people of African heritage. It often develops in us with an earlier age than people without African heritage. Those serious complications that we talked about as far as blood pressure is concerned, those have been more commonly also with people with African heritage. So the strokes, the heart attacks, the kidney failure. Those things are all more common in African-American people or people of African descent. Your family history, unfortunately, no running away from that. So if you have a history of high blood pressure in your family, then chances are you may have high blood pressure yourself. Me personally, I'll just tell you about myself. I have been diagnosed with high blood pressure. When I was in my 20s, I was not diagnosed with high blood pressure. But remember, I said I have a degree in exercise science. So when I first graduated from school, I was working at Aetna in the fitness center. I was teaching several exercise classes a day, eating relatively healthy. My diet has not always been the best, but eating relatively healthy. And again, I was only in my 20s. And at that time, my doctor said, your blood pressure is a little bit elevated. Let's just monitor it. I was not put on any medications or anything like that. But for a young 20-something-year-old who is healthy, eats relatively well, I still had to monitor my blood pressure. She still made me check my blood pressure at home. And the reason why? Because of my race and because of my family history. I have, my grandmother has hypertension on both sides. My father has hypertension. These are just things that unfortunately you just can't change. So those things that you can't change, you have to combat those with the things that you can change, which, like I said, was obesity. So once I got into my late 30s, early 40s, after having my children, I started to put weight on. I was no longer working as an exercise physiologist, so I wasn't exercising as much as I normally would. And that put me at a higher risk. Instead of just being elevated, my blood pressure shot up and I had to start taking medication. So I had to get back into the routine of exercising on a more regular basis. And again, my life is not as conducive as it used to be to exercising, so I get it in when I can. And I try to do the best that I can. But those things that you can control, like I said, the exercising, the diet is an easy one because there are so many foods that can help with your blood pressure. I have a little book here that I bought called Hypertension or High Blood Pressure. So, take the cover off there, explained. This is a really good book because it breaks down what hypertension is, what high blood pressure is, and so many different terms. It's very easy to read, it's very light, it's not written in doctor language, so you'll understand it. But there are whole chapters in here. You'll see I've highlighted quite a bit of stuff in here on what you can do with your diet to help control your high blood pressure. So I've mentioned getting the no salt added foods. If you're buying processed foods and things like that, you want to make sure you're looking at the sodium intake on those foods. Another thing that you can do is it talks about how potassium goes with high blood pressure. So we talked about sodium, and sodium, as I said, increases your blood pressure. Potassium actually tries to fight the sodium. So potassium is a good thing to make sure that you have in your diet on a regular basis. But having said that, you want to make sure that you are not taking in too much potassium, because having too much potassium in your diet will cause other issues. So, too much of a good thing is not a good thing. All right, so we want to make sure that we're not eating too much potassium. But we want to make sure that we do have some of it in our body. Foods that are high in potassium that you might want to consider are there's fruits like apricots and bananas, oranges, tomato puree and tomato juice, currants. Those are all things that we would eat that are high in potassium. We also have salmon if you like fish. Tuna is high in salmon, tuna is high in potassium. Fat-free milk, macadamia nuts, mushrooms, wheat germ. Those are all things that are really good to help with keeping the potassium in the body so that we can negate the effects of the sodium in the body. One thing that I did not know that I learned from this book was celery is really good. thing to eat on a regular basis because it helps to relax and smooth the muscles of the blood vessel walls to help decrease blood pressure. So that was an interesting fact that I learned in here. Other foods that, of course, help you to decrease your blood pressure. I'm sure you've heard about these. Garlic. There's lots of news out there about garlic and all the benefits of garlic. It does have powerful antioxidants in it to help thin the blood in the arteries so that you have good blood flow. It's best if you eat the garlic raw as opposed to cooked garlic. But you don't want to eat too much of it because if you eat too much raw garlic, it has some side effects like rashes and things like that. So we don't want to have too much of the garlic in the system. Onions also have a flavonoid component that helps to lower cholesterol, helps to promote weight loss, and helps to protect the heart from heart disease. So if you didn't know, onions are a good thing to eat as well. Of course, they should be raw as well rather than cooked, and don't have too many because they have ill side effects as well. We all see the Cheerios commercials about how they help lower cholesterol because they're high in fiber. Oatmeal helps to decrease your blood pressure. Anything high in fiber, like the Cheerios, will help to decrease your blood pressure and improve your digestive health. So those are good things that you need in your diet to help combat high blood pressure. Now, water is, I can't say it enough, one of the most important things that you should do on a regular basis. I know the thoughts of water and how beneficial it is to you. I have a hard time getting it in just like everybody else, but I promise you, it is very, very important for you to get your water in. It can help with your weight loss, or weight control. It can help with your blood pressure. It can help with so many things. Your skin, your digestive system. Water is very, very important. It's one of the healthiest things and most affordable things that you can do to help yourself as far as blood pressure is concerned. If you have prolonged dehydration, it causes your blood vessels to tighten and constrict, which gives way for the body to retain more fluids. So going back to what we talked about a little while ago, when you have more fluid in your blood system, then your blood pressure is high. So when you're dehydrated, you're constricting and tightening those vessels and you're retaining the fluid. So we want to make sure that we're staying hydrated, getting that fluid in so that our muscles are relaxed and smooth and the blood flow is good. So our blood pressure will go down. Let's see. Moving on, we have also monitoring the blood pressure at home, why we want to do it. Blood pressure monitoring at home is important because it can help with early diagnosis. As I gave you my story at home, or before, my doctor wanted me to make sure that I was monitoring my blood pressure at home so that we could see when my blood pressure stopped being normal or elevated in my case and went into another stage, which was hypertension. So the fact that I could monitor my blood pressure at home, we were able to detect when exactly my blood pressure changed from elevated to hypertensive and when I needed to actively do something. It can help to determine what medications you need, what medications are appropriate for you. And as I said earlier, it can help to cut the cost of your doctor visits and that sort of thing. Because, again, you're monitoring your blood pressure at home, you can call your doctor and say, hey, my blood pressure has been running really low, or my blood pressure has been running really high, and your doctor can make some adjustments based right off of that. So we want to talk about monitoring your blood pressure at home now and the different ways that you can monitor. We have lots of different equipment to monitor your blood pressure. Here, I'm just going to go through the equipment real quick and we'll talk about how to do it and then we'll start to demonstrate how to do it. We have different cuffs here. So this right here is a manual cuff, okay? You take this manual cuff and you use it with a stethoscope, okay? So most people won't have this at home, but I'm gonna run through it just in case there are people who have it at home and are not quite sure how to use it properly. So we'll talk about that and how to use this properly. Then we have what most people will have at home, which is the automated blood pressure machine with the arm cuff. There are several different types of blood pressure machines. The automatic with the arm cuff, the manual at home. Then we have ones that go right on your wrist. You just put it right on your wrist and you take your blood pressure. And before I was doing the research for this project, I had no idea, but there are finger blood pressure cuffs. I had no idea about that. But there are ones that you simply put on your finger and monitor. Now, needless to say, those are probably not the most accurate devices to use. So I would probably stray away from getting a finger one. Even the wrist one, if you can help it, are not quite as accurate as the actual cuffs that go on your arm. So best bet is a manual or a cuff automated machine, okay? So those are the different types of machines. If you don't have a machine, you can always go to a public location. You know, any of your pharmacies, CVS, Walgreens, those are probably the only two pharmacies left. I think they're buying out everybody. But you can go there, you can go to Costco's or Walmart's or, you know, wherever. And they typically will have a machine there, a device for you to use. Now, in this day and age, they might be blocked off, but hopefully when COVID is over, you can go back to using those sorts of devices if you are not able to get your own device and you need to know what your blood pressure is. So those are great for giving us some general information. I would not solely rely on those if possible, because you know there could be some limitations. We don't know what the calibration is of those machines, how often they're calibrated. You know, we don't know if when you're in there and you're doing it, if you have it on properly, if you're doing it properly. So it's a good way to get some general information, but I would not rely solely on the public use of that. Okay, so let's talk about buying your device. There are things that you need to do and things that you need to know when buying your device. You first have to decide what kind of device do you want to get. Do you want to get the good old-fashioned manual? Do you want to get the automatic cuff? Do you want to get a wrist one? You know, again, I would stray away from the finger and the wrist unless it's absolutely necessary. Perhaps, you know, your arm is too big for the cuff size, and so, or it hurts, your skin is too sensitive, or, you know, what have you on the arm, then I would say, okay, go with the wrist, stay away from the finger. But those are things that you need to think about when you are going and preparing yourself to buy your home device. So how do we measure what size cuff we need? There are different size cuffs. This cuff here that I have, the green one, is an adult size cuff, okay? Then we have a small adult size cuff. We have a large cuff, and we have an extra large cuff. So we need to decide which cuff is appropriate for you, because with the appropriate size cuff, we're going to get the most accurate reading. So what you want to do is you want to make a bicep, and we're going to measure the widest part right around the bicep, okay? And whatever inches though that is, that's going to tell you what size cuff you need. So if you have 8.7 by 10.2 inches around the widest area of your arm, that is a small adult cuff. So you need to make sure that you get one that has a small cuff. If it is 10.6 to 13.4 inches, that is what we call a regular size cuff. 13.8 to 17.3, that is a large cuff, and 17.7 to 20.5 is what we call an extra large cuff. So those are the main cuff size. So once you have your measurements, you need to make sure you have the right cuff size for you. So what happens if you do not have the right cuff size? If your cuff is too tight or too small or too big, it can throw your blood pressure off by anywhere between 2 and 10 points. So that's why it's important to make sure that we have the appropriate size cuff, okay? We need to make sure that once we have the right cuff, that we are getting everything that we want in the display if you're going with a manual. So we have manual ones that have small displays, that have large displays, small numbers, large numbers, ones that will give you your heart rate and rhythm. Like if you have AFib or another cardiovascular arrhythmia, you know, this will tell you that your heart rate is irregular, and then you can notify your doctor. So it can help with other things as well as monitoring your blood pressure. So we want to make sure that it has all of the things that we want on it. If you are monitoring your blood pressure and your husband or your wife or your children or whomever are monitoring their blood pressure too on the same cuff, you want to make sure that you might get a device that has more than one setting. So this particular device, you can put it on 1 if you're the only one using it, or you can put it on 2 if you're the you have a second person using it. So that way, when it stores your blood pressure readings, we know who we're storing it for. So this is person 1. When we take the blood pressure, if we flip it over here, person 2 can store their readings in a separate area so that we're not getting the 2 blood pressures conflated. So those are things that you should be looking out for when you're taking when you're looking for a blood pressure monitor. Now, a lot of people are asking, what monitor should we get? It is important to make sure that you get a monitor that is reliable, accurate, and validated. And the reason why you want to do that is you want to make sure that you are getting the most appropriate readings available. Okay, so a lot of blood pressures will give you readings, but you don't know how accurate they are because this machine has not been tested and validated. So we do like to recommend this company, Omron, O-M-R-O-N, which is this monitor here. They have validated their machines through advancement of medical instruments, the European Society of Hypertension, and the British Hypertension Society. So they used their standard of code to validate their machines. So they are a little bit pricier, but they are good machines. If you would like a list of what blood pressure machines have been validated, you can just Google the website for British and Irish Hypertension Society, and they have a list of validated cuffs that are on there, and this one fits the bill, Omron. So that is why we want to make sure that we are getting validated machines. Okay. So the last thing that we want to talk about when getting a device is we want to make sure that the device is affordable, something that you can afford. So you want to make sure that you go through the range. Omron has lots of different devices, so you want to get the one that fits the bill for you. Those are all the things to consider when going to buy your blood pressure machine. So when we're measuring your blood pressure, what do we want to do? So measuring our blood pressure, we need to make sure that the cuff is appropriate and where to place it. So when measuring, we're going to palpate for our brachial artery because that's what we're measuring. That is the artery right here in your arm. Okay, you want to palpate for that, which means that you just want to feel for it and wait till you feel your pulse, okay? When you got that, we're going to put the cuff on the arm, and the bottom part of the cuff down here, this section down here, we want to make sure that the bottom part of the cuff is about a half an inch or 1.5 inches to 2 inches above that area, flat on the arm here. We want to make sure most cuffs I have a little thing here that says artery. That needs to line up with the artery, the brachial artery. So on here, it's usually right here where this is. And there's a picture right there that tells you how to line it up. You just line that up right here with your brachial artery. So we want to make sure that we have that on appropriately. When you're putting it on, you want to make sure that it is snug, but not tight. We don't want it too tight to already constrict. We just want it on there snug so that it's not falling off or anything like that. Want to make sure that we're not measuring over clothing. When you have a shirt on, you want to lift the shirt up if it's nice and loose. If it's not nice and loose, then just take your arm out your sleeve. You're at home, so shouldn't be a problem to do that. And make sure that we're testing directly on your bare arm, okay? When we measure over our clothes, or if something is tight and restricting up here, it can add as much as 5 to 50 points on your reading. So we want to make sure that we are not measuring over our clothes. Another thing that can affect your blood pressure, another thing I didn't actually know until I was doing my research for this, is that you want to empty your bladder, because a full bladder can raise your blood pressure by 10 to 15 points. So we want to make sure that we empty our bladder when we monitor our blood pressure. We want to make sure that we are sitting nice and tall at a table with a chair that has a back support on it to protect our back and support our back. You're going to sit with your hand, palm facing up and at heart level if possible, or as close to heart level as you can possibly get, so that we get an accurate reading. No crossing your legs or crossing at the ankles, nothing like that. You want to sit for about 5 minutes before you take your blood pressure, because you want to make sure that your body calms down and relax when you're doing it. No talking when you're taking your blood pressure, no watching TV, no listening to music, no listening to your podcast. Whatever you're doing, you want it to be nice and quiet. You want it to be a nice, relaxed, serene environment so that you're calm and you're able to get an accurate blood pressure reading. Your blood pressure readings, you should retake them in about 2 to 5 minutes after taking the first one, just so you can get the accuracy, make sure that it's accurate. When monitoring your blood pressure, I have to say this because we have a problem with this at work sometimes. So when you're monitoring your blood pressure, you don't want to do it every 5 minutes for a whole day. You want to take a reading in the morning and a reading at night. And the reason I say this is because, we have people call into the office and they're like, oh my God, my blood pressure was 182 over, 98. And then I took it 5 minutes later and it was 192 over 88 and and it's just going up and up and up. And the reason it's going up and up and up is because, first of all, you're not giving your brachial artery time to relax. And you're getting yourself all worked up. And so we talked about those stress levels. So when you're getting yourself worked up, your stress levels are going up, and guess what? Your blood pressure is going up too. So that's why I say in the morning and the evening, no more than that. So if you're going to do the accuracy, the 2 to 5 minutes for accuracy, do it twice in the morning for the accuracy, twice in the evening for the accuracy, no more than that. That's all you need to do. And we just want to follow it for a couple of weeks and see what the trend is on that. But never ever do it all day long, okay? You'll drive yourself crazy and you'll drive me crazy too. Just joking. But anyway, so you want to make sure that you're monitoring your blood pressure in the morning, but not first thing in the morning, because first thing in the morning, our blood pressure tends to rise. So we want to get up, start our day, and then take our blood pressure just before we eat. So you get up, you move around, start your day, do what you're going to do. And then we want to go through those steps of, emptying our bladder, sitting for 5 minutes, turning all our devices off and, all that stuff so that we're in a quiet and serene environment. And then, sitting with the your palm facing up, feet on the floor, back is upright and protected. Those are all the things that we need to do to ensure the accuracy of our blood pressure reading. Let's see. Did I do all that? So that is everything that I have to speak about. So now we are going to do some actual demonstration. So I'm just going to grab a sip of water and put my mask on. Okay, grab my mask. And we're going to have someone come over to do a demonstration. Okay, so I'm going to do a demonstration with both of the devices. So as I said, this is the manual device. We use this with the stethoscope, okay? So, I think I can do this. You think so? Okay. I was gonna say we're gonna do it over her shirt, even though I said not to do that, but she thinks she can take it off, okay? One arm. She's taking one arm out, okay. Okay, perfect. So normally I would have her sit and relax for 5 minutes. Of course, when you are at the doctor's office, there's not always time for that. So, you know, we come in, we rush it in, and they take your blood pressure right away. Unfortunately, that's the way it is. We palpate right here for that brachial artery, okay? And once we have that brachial artery, we're gonna line that up right there where it says artery, about 1.5 to 2 inches above. And we're gonna put this cuff on. Perfect. So when you are taking your blood pressure at home, you would hold the valve in your, the gauge, I mean, in your hand, in your left hand, the same hand that you are using to take your blood pressure. And then you would put the pump in your right arm here. Now there is a little gauge on here that we need to tighten. So to tighten it, we turn it clockwise, and that makes it tight so that the air will go into the balloon. So when you're pumping up, you want to pump up to about 30 millimeters per mercury above what your systolic blood pressure is. So if your systolic blood pressure is normally 130, you want to pump up to about 160. Okay, so we just squeeze on the pump until, you don't have to do it right now. I'm going to actually take it. I'm just telling them how to do it. So we want to squeeze on the pump until we get to 160. Of course, we have our stethoscope in, which I forgot to mention. We have a stethoscope in, and the stethoscope is placed on that brachial artery. So when we're pumping it up to 160, we're listening to your heartbeat, your pulse, okay? As we're pumping up, we pump till we get to 160, and you should not be able to hear your heartbeat anymore. So once we get to the range that we want to go to, we start to turn very slowly counterclockwise on that dial, and let the air out slowly. You want to let it out about 2 millimeters of mercury per second, okay, so that we can listen and hear. So what are we listening for? When we are decreasing it, the air out of the balloon, we are listening for that heart rate again. So when we hear that heart rate, you want to make sure you're monitoring the gauge. When we hear the heart rate, that's that top number we were talking about. That is the systolic number when the heart is contracting and pumping that blood out. So pay attention to where you see that on the dial, because that's your top number. You're going to continue to release the air out of it, okay? And when you can no longer hear your pulse, again, looking at the monitor the whole time, when you can no longer hear your pulse, that is the bottom number. That is the diastolic number, when the heart is relaxing and filling back up with blood.
So Paula,
yes.
If I am doing this at home,
yes,
I'd have the stethoscope in.
yes.
How am I holding the stethoscope here?
So maybe we want to bring it down. This is a little head stethoscope. Usually they're a little bigger, so I would bring it down just a little bit underneath.
Okay, and use that to hold it?
Exactly, and use that to hold it.
Do you ever have to use your hand to do both, or is that just too hard?
You can, if you can manipulate it. If you can manipulate it,
okay,
then you certainly can do that. It might be a little harder to do that, though, okay?
Okay.
But that is how you would monitor with the manual. So, again, just to go through it, we've got the stethoscope on, or the blood pressure cuff on. We've got the stethoscope in, sitting with our arm extended fully out, palm is facing up. We turn clockwise, and we start to pump up and then release ever so gently. Perfect. Until we can't hear it anymore. And that is how you take your blood pressure at home with a manual cuff, okay? So let's talk about, I'll take that off. Let's talk about the automated cuff. So, as I said, on the automated cuff, this one comes in a circle, you just slip your arm right through. This little valve here that connects to the machine, that's the part that's going to be over your brachial artery. So we want to make sure we're putting it in there. Again, getting it to about 1.5 inches to 2 inches above. Putting the cuff on, making sure it's snug but not too tight. Sitting relaxed, arm outright, palm facing up, back supported, feet on the floor, not crossed. Very good. And then you're simply just going to press the start button, and the automatic one should start to pump up on its own. There we go. Perfect. All right. Now this machine is actually accurate. Pretty darn close to what I got when I did a manual.
Is there more accuracy with one over the other?
Yeah, so that's why I was saying that we like the Omron because they tend to be a lot more accurate than some of the other machines out there. Not to say that there aren't other good machines out there, but because this one has been validated, you know, we like to recommend this one. Again, this one is a little pricier than some of the other ones. I have one at home that is not Omron. I got it from a drug rep, but it seems to be pretty accurate. What you can do to check the accuracy of your blood pressure machine is when you get your blood pressure machine, bring it into your doctor's office. Have your doctor take a manual reading against the reading here, and then you will know how accurate your machine is. So, you know, if this is running 20 points higher, then you know whatever you get on this, you need to subtract 20 points from your blood pressure, and that would be what your regular blood pressure actually is. Okay.
I guess I'm trying to determine in terms of the automatic versus the manual.
Mm-hmm.
In general, are they fairly consistent provided they've been tested as you suggested the Omron?
They are, yes. I mean, again, after some years of use, and you know, the calibrations are off and that sort of thing. But generally, fresh out of the box, you know, for a few years, they should be pretty accurate. Okay. Yeah.
The other thing I've heard mentioned is the white coat syndrome.
Yes.
So when you go to the doctor's office and you have high blood pressure or higher numbers than you typically had.
Yes.
How can you describe that a little bit?
So white coat syndrome is, again, that thing where when you get into the doctor's office, even though you don't feel nervous, your body just inherently reacts to the fact that you're at the doctor's office, and your blood pressure automatically will go up. Doesn't happen to everyone, but there are people who do it. So they will monitor. So when that's the case, we will have you monitor your blood pressure at home so that we can see what your blood pressure actually is when you're in a calm state and not coming into the office. Again, blood pressure is affected by so many things. So it could be just something that's going on that day. You know, it could have been your drive-in. You know, you're sitting in traffic behind a car and you're impatient and your blood pressure goes through the roof, and then you have to see the doctor. So doctors don't typically, I shouldn't say that. Not all doctors typically will be concerned about white coat syndrome. We do have one doctor in our office who says high blood pressure is high blood pressure. So if you come in every time and you tell me it's just your blood pressure when you come here, you know, he's not as inclined to believe that. But most doctors understand that that is a thing, that people get themselves worked up coming into the office. So most doctors will have you, like I said, just monitor your blood pressure when you are at home, if you have a device.
Okay.
So that we can make sure that this is not an ongoing thing, at different times of the day. Now, if you come to my doctor's office and it's high, and you go to another doctor's office and it's not high, then we have to wonder, what was going on at that particular moment. Why was it high here? If you go to the doctor's office all the time and it's high, then we'll have you just monitoring to see, what is going on with your blood pressure, when you're watching TV, or when you're out for a walk, or when you're, that sort of thing, so that we can make sure that your blood pressure is not high throughout the day, in your normal life. Yeah. Okay, great. All right, any other questions?
I'm going to back off so we can,
Okay.
I think it's easier to understand both of us when we're not.
When I don't have a mask on, yeah.
So I'm going to back up a little bit so we can be physically distant.
Okay.
Let's see, do I have any other questions? I think it was the white coat syndrome. I think the difference between using the automatic and the manual,
yeah,
in terms of the accuracy as that gets presented then to the doctor's office.
Yes. And again, as I said, we prefer the cuff over the wrist, but there are people who just for whatever reason, can't tolerate the pressure on their arm, or what have you. Then we go with the wrist. And I did not actually explain how to use the wrist, so let me explain that real quick, even though we don't have a wrist monitor with us.
Yeah, and have those been validated as much as the arm?
No, because again, they're not always as accurate as the arm, so they have not been. If you go to most sites that talk about the blood pressures, they always talk about getting one that goes over the arm. That's what we recommend at our office. It's just not as good. But again, like I said, there are certain circumstances where you just can't get, your arm is too big or your arm is too small. We have people who are 90 years old, and we have to use a child's stethoscope or blood cuff on them because, they're all of 80 pounds, soaking wet. So, this is not going to work for them. So you can get a wrist one for that type of person. And then of course, people who just can't take the pressure of having the cuff squeezing on their arm for whatever reason, any condition that they have, you might need to have the cuff or the wrist one. So when you get the wrist device, and of course, any device that you get, the first thing you want to do is read the instructions to the device, okay? But when you get the wrist one, typically you just put it right here, right under the wrist, right where we would take our pulse at. It goes right there. The device, the display is usually facing you, and you want to make sure that you're following all of the rules that we talked about before: emptying the bladder, not first thing in the morning when you wake up, haven't eaten yet, haven't had any caffeine, haven't done anything except move around the house a bit, sitting still for 5 minutes, back is supported, feet are not crossed. We have the device on, we're sitting relaxed. Instead of having our arm relaxed on the table with the wrist one, it's too far away from the heart. So with the wrist one, you're going to bring your hand up to your heart, okay, and press the button and then take your blood pressure. And that is the most accurate way to get the blood pressure reading with the wrist device. So,
interesting.
Yeah.
Do any of the new technology that you wear on your wrist, I know some of them will do pulse, and I think that they detect arrhythmias.
Yes.
Do they also do blood pressure?
I have not found any yet that do blood pressure. I do not have my Fitbit on today, but when I have a thing on my phone where I can put the blood pressure, but I have to manually do it myself and just put it into the app, so it keeps record of it. I have not found any devices yet that actually take a blood pressure.
Do any of these automatic machines upload to?
Yes.
They do, to
Yes,
your
the
phone?
apps, yes.
With an app?
Yes, absolutely. I believe Omron has one. Again, it's going to be one of the pricier ones. Mm-hmm. But they do come, with all this technology. I mean, it's impossible not to do that. So you can have ones where it's like a Bluetooth, and you can just upload it right into your phone and keep track of it that way. So, okay. Any other questions?
I think that covers it.
Perfect. Okay, so that is my presentation. I hope that you enjoyed it. Remember, as we said, just make sure that you're getting the right device for you. You're taking it properly by putting it properly on the arm, not having any clothes over top of it, or underneath it, I should say. Sitting still for 5 minutes, everybody's relaxed, back is protected. Sitting with your hand face up at chest level to get the most accurate reading. If you have any questions that you want to post, I'm sure you can post them to Jenny, and Jenny can get them to me, and I will get you the answer if I do not know the answer. I work with cardiologists every day. I'll find out for you. But that is it. Thank you for listening. Have a good day.
Hi, my name is Jenny Waldo, and I am the Windsor Public Health Nurse. And I wanted to thank Paula for coming in and helping us kick off our Zoom workshop series. We'll be doing these on Tuesdays from 10 to 12 for essentially the next 5 weeks. We have a program next week on August 4th, and that will be on lifestyle modifications. We have a program then on August 11th. August 18th, we'll be talking about adherence to hypertension therapy. And then on August 25th, we'll be talking about pharmacology and hypertension. And our last program will be on September 1st, and that will include urgencies and emergencies with hypertension. So we're doing these workshops with financial support from the Department of Public Health, and then coordination from the Windsor Health Department. And there'll be a variety of speakers. So please take a look at the Town of Windsor website, where all of the programs are listed with the times, as well as a registration, so we can get information out to you. These are also recorded so that after the presentation, if you could not attend live, you would be able to watch the archived component. Also wanted to remind you that we do have some requisite documents, which include some demographic information, information about you and your history with hypertension, what you've learned from the program, as well as an evaluation of the individual workshops, and then a pre-diabetes screening tool that we would like you to complete and then return to us. So we have some incentives in order for you to do that, and that is included on our website. So again, my thanks to Paula for helping us kick these off, and we hope to see you live here, Zoom, in council chambers. Thank you.